Okay, so now brief overview of DBT, which is dialectical behavior therapy. This was originally developed by Marsha Linehan in 1993. It's an amazing treatment. If you are curious, I suggest Googling Marsha Linehan, DBT, New York Times. There was a great article that came out about 10, maybe 15 years ago, where she kind of detailed how she came up with, or in interviews her about how she came up with DBT based on her own experience, suffering with what people thought was schizophrenia in her early 20s, and how she developed DBT based on her own experience. But it's a well-studied treatment. It was developed for people with borderline personality disorders. So people who have very intense emotions, very intense relationships, and instability in terms of mood and kind of impulsive behaviors like suicide attempts and self-harm. And it's an evidence-based treatment for people with borderline personality disorder. It's also an outpatient, primarily behavioral treatment. And there's a lot of confusion about DBT and comprehensive DBT. So this is important. The DBT that's been studied in clinical trials, that it's evidence-based, is comprehensive DBT. And so this requires 4 components, which is Dbt Skills Training, which is a DBT skills course that's 24 weeks. So the person attends that usually in a group and learns the skills, and there's actually a skill book. The second is individual therapy with a DBT certified therapist, and there's a very intense certification that DBT therapists go to, and they have to go through recertification. There's coaching to ensure generalization of skills. So this is phone coaching. And what this means is that the person in DBT gets to call the therapist for these 10-minute coaching sessions in order to help use a skill. So the goal is that if someone is feeling like self-harming, they will call their DBT coach, who may or may not be the same as their individual therapist, who then coaches them through the use of a skill to prevent the self-harm. And then the fourth aspect is the DBT consultation team to support the therapist. So as you can imagine, therapists who are dealing with caseloads of people who are struggling with self-harm and impulsive behaviors need a lot of support. So it's a critical aspect that the DBT therapists are part of a consultation team that meets weekly and supports the therapists. And the goal of DBT is to build a life worth living. And there's collaborative goal setting between the therapist and the patient. They have to agree on goals to work on. So the DBT skills themselves consist of 4 modules. The first is mindfulness, which is the practice of being fully aware and present in the moment. And the goal, of course, is to be aware of mood changes and to notice what one is feeling. The second is interpersonal effectiveness, how to express one's needs and set boundaries to build healthy relationships. So some assertiveness skills and some, they use the acronym Dear Man to help people communicate their needs to others. Emotion regulation is how to change emotions that you want to change. And distress tolerance is how to tolerate distressing feelings. And I'm going to talk a little bit more about that later on. So a lot of people will look for DBT therapy, or they'll say they had DBT. And it's really important to be clear what you're getting. So I have some therapists in my practice who have done a fair amount of DBT training, and they can offer Dbt-Informed Therapy, which means as a part of their individual therapy, they are teaching some DBT skills. And I like I said, I'm not intensively DBT trained, but I do include some DBT skills in my FBT and CBT work. But that is not the real deal. The real deal is comprehensive DBT with the 4 components that I mentioned. You can also do just DBT skills training, and usually that's in a group. So that can be a supplement, to many other therapies.